pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Mr. Pratt, certify the agenda.
Good afternoon, Board of Health members. The County Attorney's Office has reviewed all the items on today's agenda. The legal approval.
Thank you. I have no disclosures for items on this agenda. Thank you. Election of officers. I'm sorry, you're going to have to help me out with this one.
So, since it is the first meeting of this year, term of office for the old officers is expiring, and it is time to elect officers for 2026.
Okay.
So there are two offices for which this applies, the president and vice president.
Okay.
So we just need a nomination of who would like to serve there. If there's multiple candidates, we'll have an election. If there's not, then it's just by nomination.
Hate to say it, I nominate you to take another term.
Are you willing?
I
Yes,
will do it. Yes,
that
thank
would
you.
be wonderful.
With respect to the vice president, I believe Commissioner Keel. So I know he's not here right now.
Yes.
We can nominate him in absentia, which is probably the best thing to do because he doesn't have the opportunity to object. So I would nominate Commissioner with my,
Yes, fine, that's fine.
Is he willing? Do we know?
I think he is. I think he was planning on it.
If he is
Yeah.
not, a vacancy would open up in that position and we could fill
Yeah.
at that time.
But this just gives us continuity, which is good.
So what I'd like to do is we need seconds.
Yes.
Okay,
Motion.
Second.
Well, you motioned to
Okay,
approve
I'll
or
second.
to
so I'll
nominate.
be the motion and Kim, you can be the second then.
Just to be clear, this is a motion to nominate Doug Benevento as president and George Teal as vice president of
Yes.
the Douglas County Board of Health for 2026.
can we do it on block? All in favor of the election of these officers, say aye.
Aye.
Aye. Opposed?
Aye.
Oh, great.
That's Mr. Van Winkle. He's-
Oh, Commissioner, I'm sorry, I didn't know you were online.
No, everything's going smoothly and I'm almost there. So see you soon.
Oh, great. Oh, thank you. Okay. We have the consent agenda in front of us. Are there any revisions to the board minutes from our last meeting? Okay. Any comments on the financial report, 28-26, or the final 2025 financial report? Okay,
I don't know if we can do this, but I would move to basically approve the consent agenda.
There should be a motions log in front of you.
Yes,
You could motion to approve items A through C of the consent agenda.
okay. Then I would motion to approve items A through C of the consent agenda.
Second.
all in favor of approving items A through C in the consent agenda, say aye. Aye.
Aye.
Opposed? Excellent. We are now on to the information only items of the meeting.
Mhm.
Director Hill.
Thank you, Mr. President. So first, I'd like to, I don't know if the board has met Dr. Dastry, who's our current medical officer for the Board of Health. It's the first time he's had a chance to come to one of your meetings, I believe.
Seen the Zoom meetings. We're a lot closer now, so right down the street from my office.
Excellent. Why don't you tell us a little about yourself? Introduce yourself.
Oh, sure. My name is Cameron Dastry. I'm been in the community for about 7 years. My practice is in Adams Ranch, so on the corner of University and County Line. If you guys remember, a few years ago, there was a Chili's that burned down. Yep, you saw the flames off the 470. So there's a plastic surgery building right there and stuff. Kind of transitioned in from into that practice. Dr. Paul Zweibel, who's been in the community for 36 years, was there. I've been there now since 2019. I take facial trauma call at Littleton Hospital, so help out our community that way as well. And I'm also on the board of Colorado Medical Society. I am the component society president at the kind of the Arapahoe medical communities. So we have subcomponents, 7 different districts. So that's my little area there. And we have a few physicians that we listen to, kind of get feedback and take it back to the state level. And then we have representatives that go to the AMA level. So it's all kind of connected in that way. Being part of Douglas County Health Department for the past 2nd year now, it's nice on a local, really local health level to be able to understand what's happening.
Thank you. Thank you. Thank you for lending us your time.
Absolutely, thank you.
Director Hill, sorry, I cut you off while you were about to give us your report.
No, I was using my privilege to introduce Dr. Dasty. Get my report kind of light this month, not because I was lazy, but because we got a public hearing and I don't want to take up time with the reports in case there's some action. So I continue to participate on local regional groups I have been in. Last week I was in Houston for the National Congress on Healthcare Leadership. Artificial intelligence is the theme of the day. Infectious disease wise, things have changed a little bit since I wrote this. Measles are really popping to the north of us. Broomfield is up to 10 cases, I believe, right now. And we've had some, people exposed and suspects that we've had to investigate, like over 100, I believe, John. So there's a lot of action in the metro area on measles. No cases yet in Douglas County that we know of. It seems to be coming our way in this area. It's something to watch out for.
Where's it coming? I mean, where's the source?
John, do we know a source for these cases in Broomfield?
Presently, there's 2 starting points, 2 completely different, unrelated things. One came from a church gathering, and one came from school activities, not related. But there are a lot of intersections, obviously, and a lot of potential exposures. We continue to work through that and work with our peers and partners throughout the Front Range.
In general, someone has traveled either to our area or someone from our area has gone elsewhere, brought this back and not been diagnosed, and then it gets loose in schools, churches, wherever. So it's a very contagious disease, maybe the most contagious disease there is.
With your index case, what was the age of it? Was it an adult that was incompletely vaccinated or a child?
School kids, I believe.
Yeah.
And I believe vaccinated or partially vaccinated. So our friends
Personally vaccinated would mean they didn't complete the series.
supposed to
Yeah.
get.
It was diminished.
And with all these vaccines, none of them necessarily outright prevent disease. They just make it less likely.
Right.
So the more vaccinated, the less likely you are to get it. It's still can't get it. Just like
Now,
the flu vaccine every year.
Although, sir, with measles, I'm concerned about adults because the complications tend to be a lot worse.
Well, yeah, it's a serious disease. It's not like when we were all, when people like me were kids, everybody got measles and it was just like an assumed part of life. Now it's kind of a big deal if you get the measles, especially if you get it as an adult.
Right. Yeah, for adults, it is serious. Kids, I had the mumps, not the measles, but kids get it. I mean, they get over it pretty quick, right?
It still runs, I'm gonna get myself in trouble trying to specify courses of disease here. 2 or 3 week course overall from infectious, not infectious the whole time, but from the rash starts, symptoms finally resolve. Right?
Yeah, it used to be 100 years ago, a major childhood killer, but we have the support now for the fevers and the secondary infections and complications. So, but it's not to be joked at if you don't have medical care. Even children die of measles.
Thank you, Dr. Field. They will be on.
Go on.
All right. So we are submitting abstracts to a couple of national meetings for our county's Healthy Families Partnership. We've been renamed it a couple times, so I trip up on that one. We think that's a model practice. We've also submitted it to the National Association of Counties. It's a model practice, seeking model practice award where it's something that they recommend. Health departments would never happen. Hopefully we'll get word. I was unable to make the meeting last week where they reviewed abstracts, one of the conferences, so I don't know whether our abstract got accepted there, but I think it'll get accepted at both national conferences. So it's a chance for us to show, the world, or the country at least, that Douglas County is out there. Or is actually the one doing that, I guess, get to break. I mentioned that AI is a big subject at the health leadership conferences, and we're dabbling in artificial intelligence pretty much on a low level right now, just using available document formatting. Being likely there, but there's more and more great tools seem to be coming our way. We're trying to stay ahead of it, at least not down. $1,000 in the first quarter of the year, which is kind of a slow season for birth and death record sales. Sales sounds like a pretty captive way to refer to it, but I mean, people tend to be buying less birth records than they get a big spike in the summer. But we're still bringing in a good amount of revenue to offset that program and keep those services available to people in our county so that they have to go elsewhere. And I think I'll stop there because I think we've got public interested in the public hearing, so I don't want to take up their time with my stuff.
This one, flu season pretty much done. We didn't have much of a flu season. I don't think.
Season is kind of like everything I glossed over that. When I looked at flu and RSV, when I prepared this, the numbers for the season were comparable to last year's. Flu numbers spiked up in the fall, but appear to be back to baseline numbers. A week or so ago, when I looked, John, you know anything different about that?
Yeah, and I think the weather had a big influence as well.
Whooping cough that we had a big deal with last year has faded away. COVID-19 is still, even though the state has scrambled up the reporting situation, it still appears to be at lower levels than last year.
Any other questions? The board members. Okay. Let us move on to the action items. Request to accept funding received since December meeting. Record. Tell us what we're approving or not.
Faster than I can notice. We've got a total of $168,099.75. Long-term chronic disease grant. This is $100,000 from the pilot program. Look at putting together a chronic disease program, which would then be eligible for $250,000. $7,000 a year to work on chronic disease issues, prevention in this county. We got some more maternal child health money, $48,100.75 there, which just continues things that we've been doing. And then we're also doing a pilot of an overdose fatality review committee. So right now we do fatality state is interested in setting up a system similar to that for overdose fatality. Got a small grant of $18,999 to pilot that and put together a committee and see whether there's a positive outcome to doing that kind of thing.
That's just a pilot program.
I keep wanting to say opioid overdose fatality review is a pilot, because it's a new thing, so they're not gonna commit to it until they see it does something.
Just to add to that, so it's a pilot with 9 counties. We were actually approached by the state to be part of that initial pilot program. They've looked at the data here in our county as well as those additional counties that are taking part. So we're looking to put together that team over the course of the next 12 months and then begin to do some review and analysis of the data from there. At that point, they'll determine if it's more long-term than just the pilot phase.
Thank you.
Any other questions?
No questions.
So I will. Well, let's first see if we have any public comment. Any public comment? Is there anybody online?
No online comment.
Okay. In which case I would accept a second in a motion to vote on the acceptance of these funds.
So moved.
Second?
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Excellent. Now let us go to the public hearing, accept public comment and consider approval of Douglas County Health Department proposed regulation 2601 regarding on-site wastewater treatment systems. Skylar is going to give us a briefing on this, and then we can have discussion, then we'll open it up for public comment. Skylar, the floor is yours.
Welcome. Thank you for the opportunity to talk about something that I am very passionate about, which is regulations. The Water Quality Commission last year changed a lot of the regulations at the state level, and they gave us a year to come up with our own local edition of those regulations. The on-site wastewater treatment system is a little unique in that the state gives us some areas where we can opt in and opt out on. And in some ways, you guys have already made decisions previously that we decided we liked the way they were going and we would like to continue doing those in that way, in that form. Among those are, continuing the licensing of contractors and cleaners, allowing the Board of Health to review any variances that come forth. How we determine occupancy, flow rates, and allowing for the permits for the continued use of the systems. We will like to also continue our implementation of operations and maintenance programs, which allows for the reduction of the soil treatment area size. Some of the proposed changes that we have will be the new licensing of maintenance providers and of third-party inspectors or system contractors. We are also proposing to end the transfer of title program. So that program is essentially when you as a property owner decide that you want to sell your house, it has a septic system. You get a third-party person to come look at everything, issue either a passing inspection or a failing inspection, turn those results into the county, and we issue a permit for that.
A permit to transfer title.
A permit on the system.
Yeah, okay, yeah.
So.
And this is done before sale? Is that?
Yes, this
Okay.
is one of those requirements that you're supposed to have completed before you sign all the documents and transfer that.
You mentioned one, the soil remediation around, you're looking at me like I don't, because I'm touching upon, but one of the points you made about soil remediation.
A reduction in soil treatment.
Yeah, I'm sorry, could you tell me just what that is real quick?
Yeah, so essentially some of our systems are fancier and they're able to treat things at a higher level before it enters the soils. And so when you have fancier systems that are able to do more things, you don't need as much soil to treat the bacteria.
So you sort of have a pre-treatment system before the treatment. Okay, thank you.
You need a smaller tree.
Yeah. So what is new? What should we be focused on when we're looking at this?
That's a great question. I think we have seen some opportunities to kind of clarify things. there has been, just items that have come forth, ways to better align with the state. Once again, some of those newer items that we're seeing is going to be the ability to license inspectors and license O&M contractors. And just, making sure that we are keeping up with some of those protections.
Stop here. Are there any other questions from any of the board members? Is there any change here that people are going to notice that participate in this program?
I think the largest one is going to be the transfer of title program. I do believe that we have some members in the room, and I have received some online comments that I'd like to share with the board for people that were not able to make it tonight.
Yeah.
So when we were asking about any concerns or questions about the proposed changes, there is overwhelming concern about the proposal to eliminate this program. Many believe that removing the inspections poses a public health risk, such as the contamination of wells, groundwater, and soil. Other people were emphasizing the financial risks. If you buy a septic system that is failing and are required to replace it, that costs money, and the tens of thousands of dollars to repair. There are also concerns about the impacts to small businesses and the inspectors who rely on these types of inspections for their revenue. There's some people are commenting about the removal of program may reduce the county's revenue from fees and potentially impacting staffing capacity. There is a strong urge from the online commenters to keep the transfer of title program and requesting for more information or a structured transition period. I think in some ways, once the board approves the regulations, there will be more efforts to provide education and provide updates on what the differences are. Why those changes are.
So, go
If I
ahead,
may.
Commissioner Teal.
So, I mean, I can understand the logic of having the title transfer inspection program, because then a buyer, does understand any risks that may be present. Can't make the decision, okay, they'll take it on. But more specifically, to make sure that that's, clean. It's a clean transfer of the property. So what's an argument that says we don't have to worry about this anymore?
I'm glad you asked that question. I think one of the weaknesses of this program is it puts the power into the homeowner. The homeowner is responsible for going and getting the workup of the system, receiving that inspection report, and then they're responsible for making the repairs. And sometimes that is with or without the buyer's knowledge. They don't know exactly what's going on with that system. So as a buyer, whenever you go and purchase a property, you're responsible for your due diligence, right? You're making sure that, hey, the home inspection, there's a list of items that are wrong with the house, I can live with that. You're looking into, oh, well, maybe I should do a sewer scope, right? That's part of due diligence. Radon testing, we know that we have radon in Colorado. So if the buyer of the property was somehow alerted to these are the problems and this is what I'm walking into, I think that would really strengthen this program. We do have people in our county that do inspections of these programs and they pass them when maybe they should have failed them. And so you end up, we have never seen the system. We get a report from someone that says, yep, I did the workup. It looks great. We see that report. We say, all right, it looks great. Here's your permit.
And there's no obligation for you guys to follow up. You're just supposed to get the report and review it.
And then, of course, not always, but we have had instances where people will call us up in a couple months and say, our system is failing. Now what? You issued this permit. I thought we were okay.
I
So-
think this does not generally fall under a standard home inspection then.
That was my question, because I know with sewer scope, you mentioned radon, those are all standard items. So couldn't the same be said about those for radon inspection is handled?
That's a great question. The way this regulation is written is that it is up to the person that currently owns the property to go and get that permit. So if company one doesn't give an answer that they would like to have, company two could very well could.
A question about the inspectors. If there's been an issue with the inspectors not meeting like minimum qualifications they pass. Since that seems to be a root cause, it wouldn't matter whether it's the seller or the buyer if we have inspectors that are inadequate.
And that is one of the newer features of the regulations that we would like to implement is licensing these third-party inspectors. Because at this point in time, they are not licensed.
So if they're licensed, would that include like being insured in the event something fails? Because as you said, they could pass some people and then 2 months later, the buyer could say, well, my system failed, but you have a licensed inspector that passed it.
Yeah, so I can't speak to whether or not they carry insurance. I would assume so if they owned a business and operated one. But what the license does is give us a mechanism to, quite frankly, find the bad apples and maybe make sure that that gets addressed in a better manner.
Let's move to public comment. Do we have a list of folks that want to come? Okay, so we're gonna do public comment. Just raise your hands, I'll recognize you. We'll get through everybody. We typically limit public comment to 2 minutes. We're not, nobody's gonna drag you off at 2 minutes and 1 second, but if you could please try to keep it at 2 minutes, we'd appreciate it. We will start with folks in the room first, and then we will move online. When you come up for public comment, if you would give your name and the town in Douglas County you live in, we would appreciate it. And then provide your comment. The board's not obligated to answer questions. If you have questions, let us know at the end. We'll try to address them, and we may have questions of you. So let's get started. Is there any public comment? Oh, well, Mr. Fielding, get us started.
John Fielding, Pinery.
Or you can stay there, it doesn't matter.
My question is that under the old regulations, homeowners were required to have their septic systems inspected within a fixed period. And in fact, the service company was required to file, or at least encouraged to file a report with the county or to have one available to the county and to the local water district, indicating the state of the septic system. I believe the period was at least once every 5 years. It could be 4 years, but I think it was every 5. I thought that was a useful feature of the old regulations, and I hope something like that is going to be continued in the new ones. Thank you.
Thank you. Let's move on to other public comment. We'll get to that question, but let's move to public comment. Is there any other public comment? Yes, ma'am.
To sit.
All right, whatever, however you're comfortable.
My
Or you can go to the dais also if you want.
And it's official. My name is Kim Sipe, and I don't live in Douglas County, but we work in Douglas County. My husband and I, Jeff, we own a septic pumping and inspection service. I'm heavily involved with CPOW, which is the Colorado Professional On-Site Wastewater, which is the organization that brought the NOT training, the National Association of Wastewater Technicians training to the state of Colorado for the use permit program and other things. I currently am also the educational coordinator for the National Association of Wastewater Technicians and have spent the last several years trying to improve and upgrade the old inspection protocol or training program that we did. I am an advocate of the transfer title use permit program. I see the concerns, and I have concerns myself with certain things of the program from my perspective of having my husband has been doing this since he was 6. He's an old guy now, so
Inspections, just
Okay. But we've been doing, we've been as a septic pump, as a septic company, we've been doing inspections since the 70s, before inspections were a thing. Because of realtors and financial companies concerned about is this system working because of the cost of replacing them. So we've been doing them since the 70s. It was in 2008 when Jefferson County started and brought in the use permit program to the state of Colorado. And then with the big reg change back in 2010, that's when they brought in and adopted the transfer of title, the opt-in, opt-out thing. So that's a little history on that. The program, if I had a president, if we had time, I could show you why this program is so vital, showing you what we're looking at. Until we had a program that actually that properties would transfer ownership and people would be buying systems with broken or malfunctioning systems and then turn around and have to pay for them. And with the cost of, we were recently involved in the last year with a system in Arapahoe County that it was $120,000 fix to fix it in existing system. So there's that part of it. Okay. The concerns with regard to the homeowner, that's been a concern of mine from the beginning. Having the buyer or the seller being having the onus of doing the inspection, they're looking to get out from under it, right? So they're looking to walk away, cheap as they can, walk away. The buyer is the person who needs to be involved in this process. And I'm not sure how we can make that happen, but that would be my where I would like to see this, the focus go, is the buyer being involved, more involved in that process. Because again, the inspection process, the counties have forms that we are obligated to fill out. Some inspectors just fill out the form, turn it in and walk away. Other inspectors, and that group is actually growing because I'm nagging them. Doing a narrative and photographs and including a lot more detail in the inspection, especially if you're calling something out as a deficiency. Make sure that they've got a picture of it so that they have they can make an informed decision. But there still is a huge disconnect because we are dealing with the seller of the home and not the buyer of the home. The seller, the title company doesn't always collect the information like they're supposed to. And the reason I think in talking with title companies, I do real estate training too, to talk to the realtors about this program, how it works, which counties are in, which counties are out, and how they work their program. But it's the title companies who, if they don't ask for the use permit and you've got a new realtor, the new realtor may not be aware of the program and it can snowball that way. The other thing again is the counties have their forms, which it changes from county to county, what boxes they want you to check off and how they want you to do the inspection. So there's that issue too, but that information doesn't always make it to the buyer in a fashion that the buyer can actually make an informed decision about that system and that home, whether they want to move forward with that or not. And that would be something I would love to see change. I'm just not sure what we could do to do that. The new NOT standards. So we again have just gone through and redone the NOT protocol, and we now have a standard that we're asking everybody to adhere to. Part of that is one of the things that we've also done is we are making anybody who holds a NOT certification a NOT member, so that we have that ability not only through licensing, which is really important. And I've been, after the different, and I deal with people that do this across the country, not just in the state of Colorado, but across the country. And I get complaints about a NOT inspector not doing what they think they should be doing. And up until not having the membership and having that ability to go back to the member and say, and investigate and see what they're doing. And now we have some teeth in what we're able to do. We had to rely on whether or not the county or the local permitting agency would license those people. If they license them, then they can start tracking them. Then they can sort out the bad apples and do something like that.
But your position, I just want to make sure that we're getting your position clearly, is that we should or should not have required testing by the seller.
I'm an advocate for the the testing, the use permit at the time of transfer. Right now, the way it's written in state code is it's the seller.
But you would like to see it to be the buyer.
I'd love to see it.
Purposes.
I'd love to see it be the buyer. Right now, it's the seller. I don't want to get rid of the program. I think it's important. I've seen enough systems and I've been involved in enough transactions. I would love to work with the counties and see if we can come up with a way to maybe get the buyer more involved in the process or something. But I would hate to get rid of the system, the process. Because I do see.
Just so I understand your position with what we're going to be faced with today is you would like to see.
I would like to see you keep it.
To keep it. Okay, thank you. I appreciate it.
Bottom line.
That was longer than 2 minutes.
I've been on a roll. I'm sorry.
Is there any other comment? Yes, sir.
I'm Steve Compton. I don't live in Douglas County either, but I work here a lot. I've back investigated a couple of sites here this morning. So I would just mirror what she's saying. I am been doing, not as long as John, but 10 years doing design work in the greater area here. I'm a CPAL certified soil technician and OWTS designer, professional geologist. The main cusp of this is the intention of Reg 43 is to protect groundwater, that precious resource that we have, and human health. But you know that's how we do it. 2 of the sites I was at today were failing and discovered because of the transfer of title program. One of which had effluent leaking on the surface. It's a danger. I had one on Monday that I was at, not in Douglas County, so not you guys, but they missed it. The inspector missed it. The previous owner had dug a pipe and made the problem go away until it came back for the new buyer. So those kind of things. The training program and licensing you talk about is wonderful. And I think that would eliminate some of those issues. So I am a proponent of keeping it, and it's a good way for you to defend your constituents too, coming in, because I don't know about you guys, but the last time I bought a house, I was pretty much out of cash when it was done through that process, and I didn't have another 20, 30, 40, or God forbid, $120,000 sitting around to 6 months later put a new septic in. And we can't rely on the realtors because they're just not trained in this. I've had a number of clients where they'll say, when we bought the house, we didn't even know we had a septic system. Right. And none of that's buyer beware, obviously, but that's what we're dealing with. People moving out of the city, never had it before. So we always like to educate while we're out there doing our design work as well. And it's it's a problem, and we try to do our part, but the transfer of title program should continue.
Thank you. Other comments in the room? Yes, sir.
Name's Scott Kellogg. I own Douglas County Septic. Don't live in Douglas County, but we're in Douglas County every day. I've been involved with the transfer title program since its inception. We have probably, I want to say 4 or 5 of our team members that are not certified, as Kim explained. I want to say that Kim's done a great job of training and education for all of us that are out there doing these inspections and being the third party eyes for the health department. But I was a little frustrated when the program came out originally, because I was wanting to focus on installing septic systems and pump septic tanks and do that. But after a year or so of performing these inspections, I saw what a benefit it was to the community, and not only the environment, protecting the groundwater, but protecting the buyers of these properties. We've run across so many. I mean, we're probably even still right now with the market the way it is, performing 3 to 5 of these inspections per week. And I would say at least minimum 50% of those we're finding malfunctioning systems or deficiencies that need to be corrected. And the use permit program has been fantastic because it holds the sellers feet to the fire to get those problems corrected. Otherwise, they're going to get pushed on to the next user. And we've seen, as Kim mentioned, time after time where the buyer of a property gets stuck having to spend $5,000 or $50,000 on repairs on their on-site wastewater system. So I'm a proponent to keep the program in place.
Thank you for your comment. Other. Do we have comments online?
Yeah. Fran, you want to go ahead?
Sure. Hi, Fran Santagata from Roxborough Community. I'm a big proponent of the, excuse me, the new ordinance that's been drafted. I think Skylar really did an awesome job of actually adding value to the state program to make it more specific for our community and to make it safer for our constituents within our own communities. I really like the idea of holding both this, holding the seller responsible, but also maybe can we do something like have an agreement where the buyer also signs off that he's been briefed as to the current state of that system as a potential additional language to the ordinance. I think this is going to save a lot of folks some real grief after they buy a place and then find out that maybe something wasn't inspected properly. So big proponent of having those inspectors certified under Kim's program for the work that they do. And just lastly, one comment. I'm wondering, did we reach out to some of the other subject matter expertises out there, such as our general managers for wastewater facilities that are out there, or water treatment facilities that may have some input but may not have been aware of the public hearing? Thank you for allowing me to provide some input.
Thank you. Other public comment? No, that's it.
That's it.
Okay. Then let's go ahead and close public comment. So there were a couple of questions. I think Mr. Fielding's was regulatory requirement for periodic testing of wastewater, on-site wastewater treatment system. Is that retained in this?
I'm not aware of the original requirement. It
Okay.
may have been something that was in previous editions of the regulation that have gone away since. We do have recommendations out there that every 3 to 5 years you get your system pumped. And it's like, obviously, like anything in your house, it's known to break down, so it should be routinely kept up with.
Okay, but there's no regulatory requirement for that to occur.
So I believe that in the past, Mr. Fielding's water district where he lives had that requirement. It wasn't.
Oh, I see.
I think.
Okay.
I remember because we had discussions like this when we did the ordinance.
So that makes sense. And then the reach out that you did, I think from Fran had the question about what kind of outreach did you do?
Absolutely. So we contacted 220 people that are actively in our system using the constant contact methods. It was in the newspaper. It's been on our website for at least a month now, if not more. And it is also on every auto reply that anybody comes to us through our EH inbox.
Commissioner.
So it seems like the vast majority of it is largely agreeable, which the goal is to align Douglas County with State Reg 43, strengthen the process, formalize the process with all the counties around us, so it's the same playing field for these inspectors. It creates 2 new licenses, the system maintenance providers and system inspectors. Requires mandatory training and mandatory continued ed, and it gives the health board or the health department a finding ability for if there is a bad actor. It seems like the sticking point is it the county's role, the water district's role, or the homeowner's role to do an inspection? Is that the case that there were mandatory inspections by the county and now there's not under the proposed resolution?
So I think the main sticking point here is that we have homeowners that want to get rid of their property for the best value they can find. And in doing so, we shop around for an inspector that'll get them to that point. And then a buyer of a property may or may not be aware that that has occurred. So we get a casting inspection, we issue a permit, and then the new homeowner is on the hook for any repairs.
Is that something that can be fixed today with this resolution, or is that an ongoing issue that's existed prior to this? Influences that mean.
Like, I believe if we have that transfer of title program, it will continue to persist because of the way the state has set up that regulation or that piece of the regulation.
So let me ask what our options here are here today, because there's two, okay, there's binary option. I want to explore and see if there's other options. So there's the, yes, we're going to require the seller to hire a third-party consultant to determine the status of their on-site wastewater system, or no, we're not. Now I don't know if there are other options, like can we require the seller to have an inspection done? Can we require the buyer to go to the seller and say, hey, we have to jointly choose a third-party inspector to do this, so the seller, the buyer has some say into the process so that they can be sure they're getting, a legit inspection report. Is our options binary, or do we have more options than that?
I think they're binary, and I'll let Skylar speak more, but basically the way the state has set up their regulation, you opt in or out of having the seller do this perk. There's not an option for us, I think, to stick in a buyer requirement.
But we have an option not to do it.
So your options, like plain options right now, since nobody's complained about another part of this regulation, is that you prove it and direct us to amend it back to require the transfer.
What I'm asking is, but it is a binary. We have the authority to say we're not going to require the buyer to do a, Commissioner.
Well, see, that is my question. So it's section 26.9 that outlines the point here, that it says it's not required. The only problem is 26.9 that we have under consideration today is 3 sentences, 2 sentences. And so my concern would be, we could pass this amending 26.9 to say does not, to say does require. But that's all the only part of the section. So it'd be simple for us to say it does require, we do require.
We have the language prepared. We knew we were coming to a binary choice, so we brought the alternative language for you to ask us to answer.
Okay, so the idea would be that we do direct staff to because we're going to need a little more meat in 26.9 in order to set out the conditions standards under which we do require the title inspection, which sounds like there's some interest for that.
Yeah, and I'll just step on Skylar's toes again here. I'm part of the inspiration for this because we're charging somebody $67 for a permit that says, yeah, we looked at the paper this guy gave us by your house. We got no idea what's at the other end of what that system looks like. So that's one thing. And then the title companies, as mentioned, are they checking that this permit exists? They're not, because we just had a closing yesterday of a house that should not have closed, but it's closed and the new owner is on their new happy life. So my feeling in wanting to pull this out was that I'm charging people $67, spending staff time, and people are still getting hosed with these bad septic systems. And that makes me feel bad. So that's my reason for, Skylar went along with it, so I think she maybe agrees too, but that was my reason for suggesting this. But I also know that when I suggest something to the Board of Health, they can say no. So we are prepared with language to undo that.
So let me just set the state of play here so we know what we're talking about. The state of play is binary option. We can choose to have the seller prepare this report or choose not to, in which case there would be no, the purchaser would have to do their own report, would have to make as a condition of closing a testing of the septic system. That's the choice we have in front of us.
It would be my intention to do a big outreach program to make sure that, to the best of our ability, sellers understand it. Like when I buy a house, I know I gotta get a home inspection. I don't wait for one to come from the seller. That would be just.
Commissioner, did you have a?
Yeah.
Commissioner,
I mean, I don't want to give folks, it sounds like we've been giving folks a false sense of security by checking that box. We ourselves are not doing the inspection. And we're not even sure how the inspection was done, if it was thorough or not. My preference probably would be pass these 33 pages and then do a tremendous outreach effort to anyone buying a home with a septic system to know, just like a radon test, you need to do this test.
Mr. Keel.
So, Mike, I want to ask you kind of a pointy question. I would appreciate a very pointy answer. So current status is we charge for these inspections. That's really just seeing a piece of paper and saying, check the block. Yes, it did. It did or did not pass. But either way, the property's already closed. Title is underway of transferring. And within the remit of the health department, that sounds like that's all that the health department has. Is there other regulations? So should there be a preceding regulation that goes in that makes this required before that title can be transferred, period?
But I don't know.
And out of another
transfer.
Out of another department, that would be in another department's purview here in the county.
I do not know. I'm not aware of authority that the Board of Health has to hold up a title transfer. I do know that we can require a seller to do something here. The state has set up a program that we can require the seller to get an inspection. If the seller fails to do that and the buyer purchases the property and finds out that no inspection was done, that is grounds for them to have some recourse against the seller on a private case-by-case basis. That's about as much as I can tell you. I'm not aware of any way, any leverage we would have to hold up a transfer of deed from a buyer and seller, but I do know we can set up a system in place so that the buyer or the seller is supposed to get an inspection. We can in some way regulate those inspectors to make sure we're weeding out the bad apples, maybe not doing it correctly. And that is a way we can start to clean up this process. I think that's the proposal here. I'm not aware of anything we would have that would allow us to just to tell someone you can't sell your property until you do this. I don't think we've been given that authority.
So Chris, let me put my other name badge on as a member of the Board of County Commissioners. Is there any statutory authority that the board can consider under ordinance, local ordinance, whereby the clerk would not complete title transfer?
It's possible. We'd have to do some research into that. We would be straying into an area of people's rights to dispose of their property and to purchase property. So we'd have to look into what kind of authority the county has and how far we can exercise authority. Obviously, the county has authority to protect the health and safety of the community. And so that's a pretty broad authority. But whether that would extend far enough to completely prevent a private property owner from selling their property or a private citizen from purchasing the property, we'd have to.
Yeah, so what I heard, and I apologize, what I heard you just say is we're gonna have a requirement that's toothless. So you say, okay, your point to Commissioner Keel's question is, well, we may have problems interfering with somebody's right to dispose of their property. But so that would mean that that's clearly not what we're doing here. So we're just creating a requirement and hey, if you meet it, you meet it. If you don't, you don't. But we've just created a new reg just because.
I wouldn't categorize it that way. If I understand correctly, what we've done is we've set the stage for that homeowner to have a recourse against the seller. The seller had a requirement. If they did not fulfill that requirement, or to remove some of the bad actor inspectors who are not doing appropriate inspections by removing their license. So there's some leverage here. I wouldn't call it completely toothless. It may not be a canine, but it's a molar.
Well, what's the ultimate on this? Suppose somebody fails an inspection, and we say that as the Board of Health, that you cannot use this system until something is brought into compliance.
Yes.
Yes. So that's the ultimate hammer that we have. And the question is, will it affect the seller or will it affect the buyer?
It affects the owner.
Yeah. So
if the deed is transferred.
we cannot
it's
be
the-
using this system if it's failed.
Correct.
And of course, then if we want this to have the effect that we want, which is on the seller to have responsibility, then the burden's going to be on the health department to review the report that comes in, make a determination on whether or not the report demonstrates there's a useful system or a non-useful system. And then you're going to have to show up at closing or before closing and say, you don't have you can't use this on-site wastewater system. I mean, that puts a pretty big burden on you guys.
If you're one of every real estate closing in the county, I'm gonna have to hire an FTE for that. Quadruple or quintuple this.
Or send a letter or something, but I mean, that makes me very nervous because we're starting to wander into
Should we
deep
deal with
into
this
this
at all?
process.
Well, and so that's where we kind of started from tonight is my uneasiness with charging somebody $67 for a permit that just means I saw. it before. Don't know if that puts it in the back of the papers.
And they come back and then take legal action against us because we didn't do our due diligence.
Yeah, well, that's a big, nice disclaimers, but it still beats the thing.
Still.
We're responsible for doing a permit based on this.
Yeah.
report.
I want to get legal advice from the guys here, so I'm not going to opine about our liability, but I would say there's a lot of protections for the county against that kind of liability.
Yeah, but they're not 100%.
They're not
I
100%.
remember
Well, I'm less worried about the county, quite frankly, than I am about creating
Board of Health.
expectations. Whether we're actually doing something here that is helpful, so.
This was a seller or buyer requirement and the closing agents were going to pay attention to it. I'm all on board with it. We've got experts in the room. Way more time than me in the septic tank business.
So who's
That would
paying
be
the
great.
fee?
Right now, I
It's
just
the
have
seller.
it's a sieve. Things are like, maybe some things are catching, others are passing through, but people are losing tens of thousands of dollars.
But who pays the fee? Is that the seller?
So pays the fee, but it's like
And so they're
67 bucks. on a
responsible, I would think.
Sounds like many are sold without even bothering.
It's not gonna stop a closing.
It does give a tool for a buyer who's wary and does their due diligence and knows that the seller should be doing that, and they can ask because they know that that's required, and the seller can't say, well, I don't have to do that. You do, it's in the regs. I know you have to do that. And it gives a potential recourse if they buy and it was not properly inspected. So it at least ensures inspections should be getting done and gives some ability for buyers to have.
No, I
something.
think we get the policy arguments. I think we get. I think it's just a matter of what the board's will is with respect to wanting to make this a requirement or not. And so, we have a proposal in front of us that does not require the seller to prepare a report. But let me suggest this to start moving us towards a decision. I'd accept a motion in a second. And then if somebody wanted to make an amendment, we could amend and we have language ready. We have language ready. And we could then have a vote on an amendment if somebody wanted to amend the proposal. So is there a motion and a second?
Honestly, Chair,
Yes, sir.
I'd like to hear the amendments, what such amendments could be.
Okay,
If we were to pass the regulation as presented to the, and we still would like to see some tweaking going on in 26.9 or more. I'd kind of like to hear what that amendment would be before considering the regulation.
If we were to continue having the transfer of title program, we would largely borrow the language that is already in place at the state level. And it would very much proceed as we already have been operating in business. So we would get the application $67. A licensed inspector at that point in time would be presenting us with paperwork that says, yes, the system is good, or no, it's not. Staff would review that paperwork and either issue a permit or an acceptance document is what the state really wants to. All of those pieces and parts would remain the
So
same.
you would just put that into that 26.9 that says we don't require it. You would put the language, which is basically what we have in the current ordinance.
There's one place that it cascades into as far as the electable options go. By not having a transfer of title program, it does take away one of the electables, so we could explore swinging that in.
okay, so the language would be a requirement for the, we don't have actual, do we have actual language? Do we have something we can, like, you can read off to us?
I do.
Oh, perfect.
Give me 1 second. I'm just trying to find it in all of the folders.
In the meantime, the other 33 pages of the proposal would strengthen requirements and ensure that, probably 95% of inspectors are doing good work, would help weed out those other 5% versus the current state.
Yeah, there's like 98% of this that is fully acceptable.
Yeah.
We haven't heard a word from industry participants. It seems to be fully acceptable. I just read through it for the third time. I'm still trying to find other places to poke holes. I can't.
Or should be supplemented by additional education for people that have septic tanks.
For process, oh, sorry. For process purposes, we could use the language you have in your motions log. We could simply add a condition of approval. If you go with approval, which it sounds we're leaning towards, a condition of approval that the transfer of title inspections language be changed to require such.
Yeah, let's read that language for us, so we know what we're looking at.
Douglas County Health Department requires a property owner of a residence or other building/facility served by an OWTS to have an inspection of that system by a licensed systems inspector to determine that the system is functioning according to design prior to the covered transaction of the property. Certain types of covered transaction are not required to have inspections, and that is already defined in the regulations that you have been presented under 26.15 letter G for covered transactions and exemptions.
So, procedural, do we do a motion and second, then amendment, or do we do amendment? How do we?
I think what we could do is we could do a motion to approve, if that's the
Right.
desire. And then at the end of that sentence, instead of as
Well,
presented,
let me, you're misunderstanding my question.
I do.
Because we're gonna have a vote. And so we're gonna, do we put it in front of the board with a motion and second and then do an amendment to the,
Yes, there's two ways you could do this. You
Right.
could do this as you're proposing,
Right.
as a motion and a second, and then a friendly amendment to that motion. Seems a little more complex. Or
Okay.
we could simply do a single motion to approve with the condition that the transfer of title inspections by seller be included as indicated by staff. And that
Right.
could be seconded and voted on, and there would be no need to amend.
well, but there could be, then there's a no vote. If you wanted to vote no on that, though, then you're voting no
On the whole thing. Yes.
motion, on the motion. Yes. Sure.
So if you wanted to vote on the amendment.
How is my process more complicated, Mr. Frank? I have no idea. I mean,
It depends on perspective. It's,
Yeah, I want
If you
to
want
vote
two
on the,
votes.
let me, I'm overruling council. I want to vote on the amendment. And let's do a motion a second. Let's have an amendment and then we'll vote on the amendment, then we'll vote on the final passage.
Chair, may I suggest? So before we consider passing the entire regulation 2601, we have a course of action that would make amendment to section 26.9.
Yes.
And we have staff prepared to offer the nature of that an amendment to the proposed regulation. We actually amend 2609 section first. Then we take the motion to pass regulation 2601 as amended.
Okay,
That's a
Okay.
proposal.
okay, I see what you're saying. So you do the,
So someone should say, I move an amendment to
Right.
section 26.09.
If it please, may I ask, Skylar, may I please ask you, can you give us one more time how we would amend 26.9 in order to preserve the title transfer inspection?
Absolutely, I'll read it once more.
Could you please?
Douglas County Health Department requires a property owner of a residence or other building/facility served by an OWTS to have an inspection of that system by a licensed systems inspector to demonstrate that the system is functioning according to design prior to the covered transaction of the property. Certain types of covered transactions are not required to have inspections. See 26.15G for definition of covered transaction and exemptions.
Chairman, if it please the board, I would propose an amendment to section 26.9, transfer of title inspection, to read in the current draft, Douglas County Health Department does, striking not, require a property owner, and then further amending 26.9 with the language just given to us by Health Department staff. That is my motion. I urge a yes vote.
is there a second?
Okay, I will give you a second.
All in favor, say aye.
Aye.
Opposed? Okay. So now I will accept a motion and a second. That was the best procedural point.
Thank you, Mr. Chair. I move to approve the updated DCHD regulation 2601 as amended regarding on-site wastewater treatment systems as presented.
Second.
All in favor, say aye.
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 Opposed? We are.
And then Chair, if it pleases the board, do make a motion to give direction to the Health Department Director that this be brought back next year after 12-month period for reconsideration based on data gathered.
Yeah, we can agendize a report and then possible action. Just a report on what we observed.
And specifically 26.9, I think you presented very salient logic. And obviously, we've heard folks say we probably don't want to eliminate, but your salient logic, we may have data that makes it worthy of reconsideration to not have the title inspection with a year.
Or the state may come to the conclusion that they should put that to the buyer's side of the transaction where you're gonna get
Right.
more success and because I'm all about the buyers of doing proper due diligence and maybe us charging them $67 per to make them do due diligence. Right now, I'm just afraid the due diligence is on the side of maybe the less diligent party in transaction.
It would seem reasonable that this is an expectation on the buyer, but we don't have that option. But I agree with you, Director.
Well, that's a motion to give direction to the Health Department Director. If the chair would recognize and call for a second.
Second.
Okay, all in favor of us coming back in a year to review this and doing an update as necessary? Say aye. Aye. Opposed? Excellent.
And in the meantime, Mr. Chair, there is an association that is active, both at the state capitol and nationally. Could pursue policy.
We hope you do that. Okay, so we are now at the citizen comment. Is there any general comments in the room that folks would like to make? Any general comments online? When is our next meeting, Mr. Hill?
It's June, don't stay in the same. June something, June 11th or 12th.
If we have another meeting in June, I would accept a motion and a second to adjourn.
So much.
And second.
All in favor, say aye.
Aye.
We're adjourned. Thank you.
Commissioner Field is-
What a huge change. What am I gonna do about this changing? I hope